Hi, this is Dr. Jina, and I'm a vegan, and I'm curious why she has become a vegan. And what is your background first, even before becoming a doctor?
Sure. So I grew up in a Jain family. My parents came to the US from India before I was born, and they strongly taught me about the value of ahimsa or nonviolence. And I was vegetarian all my life. When I was a child, my mom explained to me why we should be a vegetarian by saying, if you were an animal and somebody ate you, how would you feel? And as an 8-year old, I had the empathy to take that to heart, and I really was a strong vegetarian. But at the time, I had no idea that there was anything wrong with having milk. As a Jain vegetarian, I knew that I wasn't supposed to eat eggs, and I never had eggs in the house. Occasionally, when I was with friends, there would be eggs in things like cake. And so sometimes I consumed them as a kid. So I was coming from nonviolence and wanting not to harm animals, but not really knowing what happened with dairy and eggs. Eventually, as I grew up, I started to want to become more careful about not eating eggs, but I still didn't really know why. I just knew that it was one of those things that you're supposed to follow as a Jain. And when I was about 20, my parents took me to Siddhachalam, which is a Jain ashram in New Jersey. One of the two monks that came to the US from India, Acharya Sushil Muni, established an ashram. They had a lot of different programs at that time. I had gone as a camp counselor. And this particular time, my parents took me to what they thought was just going to be a puja at Siddhachalam. And it happened that there was an animal rights conference put on by New Jersey Animal Rights Alliance. At that conference, I learned what was going on with milk and with dairy, with eggs production and milk production. And I was shocked. As I walked from table to table, talked to people, saw videos, looked at brochures, I understood that the connection between the meat and the dairy industries is so tight that, as many people have discussed already, there's just an unacceptable level of suffering and killing that's involved of the dairy cows and their calves, the separation between their calves, and in terms of the eggs of the hens and the chickens and the male chicks being harmed. So whether you look at it from the perspective of suffering or harm, or from the perspective of death, I didn't want to be part of that. It took me a little while to go from wanting to be vegan to actually being vegan. And between those two times, what happened was I went back to Siddhachalam and I saw a mother that was raising her baby vegan. And I was completely inspired because I thought, at the time I was a college student, there was no one that needed to cook differently for me most of the time. I didn't have to take care of anyone. And I thought, if this mother can do it, and she appeared to be well informed and healthy, and so did her, her baby appeared to be healthy, then at least I could do it. So from that time on, I was vegan. And so it's been more than 20 years now that I've been vegan.
And what about your background in terms of training? How does that fit? I mean, first, if you tell me a little bit about your background in terms of training and work.
So I'll tell you how the being vegan led to what I wanted to do and how my training grew out of that. There were two ambitions that I had as I was thinking about careers. One was that I wanted to help in international settings, and I knew I wanted to do something public health related. But the other influence was actually related to my immersion in the literature related to veganism and health. Because I became vegan in college and because I knew I was headed for medical school, I started reading material from Physicians Committee for Responsible Medicine, PCRM. And their position was that animal research is not the best way to get information on health. Their position was that that some of the advances that have come out of what people attribute to animal research could have come about other ways, and that epidemiological studies are very informative. That is, studies on human populations in which you can observe multiple risk factors and outcomes are very informative and perhaps more informative than the animal research that harms animals and tries to reduce questions to single, narrow topics. So I thought, I want to get trained in this subject of epidemiology, and it fit with my public health ambition to do something public health related in poor areas like India, like where I had visited as a kid. So I was headed to medical school and public health school to fulfill those goals. And as I went through college and medical school, those were the early years of my being vegan. I tried to keep up with some of the literature. Some of the issues that people were very interested in included, will you get enough protein as a vegan? Will you get enough calcium? And since that time, there has been a growing awareness of vitamin D, of omega-3 fatty acids. We've always known about B12. That was actually an early concern as well. So I tried to really inform myself about these topics. And then when I finished medical school and my public health degree, I decided to do a family medicine training because it's the broadest background, and a general preventive medicine residency because it incorporated both the public health background and the clinical background. I worked at a public health agency for 4.5 years, and I also did some part-time practice before and after the public health work. I saw a few patients that were interested in making a change to a plant-based diet, a patient with diabetes who was ready to get off of her medications because she was in the hospital acutely. For a while, I worked at the Veterans Administration Hospital, and there were many men that had high cholesterol, men in their 50s, 60s, 70s, and I counseled them to a plant-based diet. I never really called it vegan because I feel that vegan refers more to ethics, and plant-based refers more to sort of health benefits. And I sometimes termed my advice, or sometimes phrased my advice in terms of eat more and more plants, eat less and less animal-based products. Meat is the most directly connected to saturated fat and cholesterol, and those kinds of messages.